So hello everybody, we are looking at the next video, which is all about how are the alpha islet cells of pancreas responsible for the weight gain. When we're looking at pancreas, we're looking at the area which is responsible for the sugar regulation, and of which there are two kind of cells which are called alpha islet cells. Islet means island, alpha islet cells and beta islet cells. Alpha islet cells are present on the left side and beta are present on the right side of the body. The reference is taken from Psychic Roots of Diseases. And let's go further. And I love breaking down words, and it's amazing to see what words really mean. So when we're looking at pancreas, we're looking at all flesh. Pan means all, and creas means flesh. So it's a part which is all flesh. There is no bone there. Islet of Langraiz is islet means island or a peninsula. If you look at the shape of the pancreas, it looks like a peninsula. And Langraiz means it was actually taken, the scientist who actually found out about it had ending name as Langraiz, and so it is named under after him. Langer means penis, giving a hand or seal of promise, and something that you're creating over there. It's all about creation. What does the penis do? It's creating children. Over here, this is creating sugar of your life. It is creating something that is sealing it with the promise, and it is used for regulation of sugar levels. Now, what do you look at sugar levels in your real life? What do you think of? We call our sweetheart honey, and it's almost like we are saying that that they are the sugar of our life. Our children are the sugar of our life. The good things that happen around us. The sugar is a sugar, but there are other people who are also like the sugar in our life. And blood is all about our identity. Blood is all about our family. So when we say blood sugar levels, we are talking about the sweethearts that are present in our family lineage, or who we feel attached to, and the glucose of our life. Now, these are the alpha islet cells, are the group of pancreatic cells which help in secreting insulin and glycagon, of which the alpha islet cells secrete the glycagon and the beta islet cells secrete the insulin. So let's go further from here. And just to let you know where it's present in this diagram, you can see in this picture, you can see where exactly it's present in our body. So I would first like to carry you through the function of the alpha islet cells of pancreas. And like you can see, the picture of the pancreas is the yellow part in that picture. And this is the part that secretes glucagon, and which in turn will stimulate the liver. So basically, the secretion is glucagon. Now, this is going to make the liver, or stimulate the liver, or kickstart the liver to convert, that is, glycogen into glucose. So basically, it's the liver is then changing the glucogen into glucose. This is causing the blood sugar to increase. So this is causing the blood sugar to be like in a certain space. Now, this is the actual function of alpha islet cells. So let's repeat it again once so that it's like retained in the brain. The alpha islet cells are going to secrete what is called the glucagon. Glucagon is going to stimulate the liver. The liver is going to convert the glucogen into glucose, and this is causing an increase in the blood sugar level. Now we know that according to Meta Health, that there is a Yudin or a shock that happens, which was a shock or a Yudin is something unexpected happens in our life, something that's extremely dramatic, that leaves us all alone, and we have no plan how to deal with it. These are the areas in our life which are registered as a conflict that happened in our life. And in any disease in our body is an adaptation to this conflict that happened in our life. So let's see what are the conflicts that are connected with alpha islet cells. The main emotion over here is that of a disgust, like it's just not okay with someone or something. It could be to do with revolting sexual experiences, sexual abuse, unwanted sexual practices, or violent sex. These are all the places where it could be unexpected, it could be dramatic, it could leave you feeling all alone. You may not have a plan how to get out of it or how to deal with these stories in your life. This, of course, can cause a lot of pain in your system and take away the sweetness from your life. There's also many people who feel disgusted at the sight of the blood. I know my mom, if she would even see blood, she would faint. And fainting basically means the blood sugar level became so less that she couldn't deal with it. Feces, it's like, let's say you're going out there, you've never had a dog in your life, and then you're going out and you have to pick up dog's feces to put it in the bin, or you have a little baby now and you have to clean her or his shit or his feces. And this could leave a very disgusted feeling in your life, which could actually stimulate the liver and which could actually stop or may not be able to how do you say you may not be able to deal with it, and this could then bring down the function of the alpha islet cells and thus reduce the sugar in our body. Urine is another thing, and vomit. So basically we're talking about all the human discharges which can create a feeling in your body, and this yucky or disgust feeling can then impact the functioning of the alpha islet cells. You may be disgusted with people who are on drugs or alcohol. It could be due to your religious beliefs or because of the experiences that you have. Maybe somebody is you have seen, or somebody at your home comes back drunk and they behave in a very different manner. And I know of a person who would drink, then call up his girlfriend and would say things that he would have never wanted to say otherwise. And then he would apologize the next day. Even if he was sitting next to her and if he was drunk, he had no control over his tongue. Now, during these times, the person who is taking all this, the lashing of the other person may feel extremely disgusted, and it just may not be the smell. It may be everything. The tracks may be with how the person is looking at that time or how they are behaving. So anybody after that who is also behaving in the similar manner, even an act someone is putting and they have not even had an alcohol, can maybe create the same disgust feelings. The thought of going for chemotherapy may put you off completely, or any idea of disfigurement. I know, there was this whole movie created on acid lashing where somebody has just come and thrown acid on the girl's face. And I also know of many people who are lying down in the burn ward because they have been, they couldn't, how do you say it? They've gone through domestic violence, and or it's by accident that they have got burnt and the body really gets disfigured. This could make you feel like, oh, what is happening? And it could then cause the feeling of disgust, which could further lower the functioning of the alpha islet cells. So let's look at it, how it really happened. Let's go through once more. What's the function of alpha islet cells? Like I explained before, this is really important. Alpha islet cells, which are there, secrete glycagon, which stimulates our liver, which converts the glucogen into glucose. This causes the blood sugar levels to be increased in the body. Now, this is the normal function. When the urine happens, when the conflict happens, then what happens? Then instead of the alpha islet cells reduce in function, and because alpha islet cells are reducing in function, glycagon is also reduced in how much it is getting secreted. Now, if the glycagon is not getting secreted. It will not stimulate the liver in the same way as it did before. And thus, sugar is not retrieved from the liver. So the liver will not convert, like mentioned over here, glycogen into glucose. And there will be lower conversion of glycogen into glucose, and thus decrease in the blood sugar level. And this decrease in the blood sugar level is called hypoglycemia. When this hypoglycemia occurs, the symptoms are the person feels nausea, dizziness, fainting, trembling, pale skin. You may have fluttering heartbeat. You may feel as if you're walking on air. You may have lack of concentration and conscious disturbances may happen. You may also have headaches, or you may just want to eat so that the sugar level comes back to normal. And this is the time when we are binge eating. Like really, we cannot stop ourselves from eating. Along with that, you may have a defensive attitude. So if somebody tells you, hey, you shouldn't be eating so much, you'll just look at them and say, so what? What's your problem? And it keeps things or people at distance and compulsive cleaning. So you are into some kind of a cleaning mania at the same time, where you would want to keep people at a distance. You want to clean the house. Cleaning is basically you want to bring that clear. You're cleaning the feces, you're cleaning the blood, you're cleaning something that internally you're feeling disgust, but actually you have to deal with that disgust rather than just cleaning it. So because of now all this constant hunger, low blood pressure, you will have craving for sweets. So you will see normally these people are constantly craving for sweets. They have hunger attacks, low sugar level, generally goes otherwise unrecognized. And this all could then lead to weight gain because the person just can't stop eating. And the weight gain or obesity can happen. Now, the questions that you need to really ask yourself, when did these symptoms begin? What symptoms are we talking here about? Symptoms about where you're eating, binge eating, maybe feeling dizziness, maybe feeling headaches, maybe constantly feeling fluttering in the heart. So you have to go back and look, when did these symptoms start? Even because these symptoms started way before your weight gain really happened. So if you can identify when did these symptoms start, you can then start work on that area and can revive your system back. What disgusted you at the time, what disgusted you at the time when these symptoms were there? Always ask the person what happened in their life. Could it be possible that they had adverse living conditions at that time? A job loss, maybe a loss of a partner, something that the partner did that could have disgusted them, maybe an accident that happened that could have disgusted them. And what kind of beliefs are they carrying from their childhood? Now, if a child has been taught that, has got very strict, regime as a child, he's been asked to constantly keep a place clean, that will get completely enhanced or become even more, because already in the belief it is that we must keep everything clean, there must be nothing dirty in our place. So look at the beliefs and conditioning which are causing it, and work on those conditionings, work on those beliefs. And it's really important to identify these conflicts in life and resolve them in real life. You need to find where, as I began, that blood sugar, blood basically means my family, and sugar means my honey, my love. So where is the love? Where is the love? If you can find where the person can find love, you can find solution over there. So these people are basically manifesting, creating things in such a way that they are putting people at a distance. So even if somebody wants to love them, they don't feel it. They are at the same time searching for the very love that they can't connect with. So try to find for them or ask them where their love is, and you will be able to find the solution. Very important to tell yourself, I am loved. I'm divinely loved and cared for. And everything around me is love. So let them feel that and create that love for them. It could also be work that can be loved. It can be a hobby that can be loved, but create that love for them. Thank you very much.
Help Talks are daily health-related talks held at Health Education Library for People, Mumbai, India. For more information visit www.healthlibrary.com. Subscribe to Help Talks channel. Be better informed about your health.